order of business, want to read our Nashville General Hospital mission statement to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. Our vision, be a leader in exceptional community health care, one neighbor at a time. So we are calling everybody to order. Welcome to our committee members, Mr. Harvey, Dr. Martin, and we also have from the board our chairman of our board, Ms. Smith, and also Dr. Miller, who is a member of the Hospital Authority Board. Does anybody have any conflict of interest that we need to be aware of today? Apparently not, so we will move on. We read our mission statement. Do we have any people signed up to make a public comment?
No, sir.
Okay. Now we can move right into our activities for the day, unless each of our committee members has anything they want to say before we start our meeting. Seeing a nodding of heads to the negative, we will move on to our new business. And the first thing is a marketing update from Kathy Poole, our head of marketing. Kathy, it's good to have you with us today, and I know you're going to go into some level of detail because we're at the next level from our previous meeting, and it's important for our committee members to know some of the things that you're doing and have the opportunity to ask some questions and maybe even make some suggestions. So, Kathy, it's all yours.
Mr. Chairman, should we approve the minutes of the last meeting? We have them, but I just...
We should, and I missed that completely on the agenda, but you're absolutely right. I'm sorry?
I move approval of the meeting.
Is there a second?
Second.
Any discussion? All those in favor say aye.
Aye.
All opposed? The ayes have it. Thank you, Dr. Martin, for that suggestion. Let's move on now to Kathy and the marketing update.
Testing 1, 2.
Okay, we have a test.
Testing 1, 2.
Nothing like an introduction like that. Good afternoon, everyone. Thank you, Mr. Lesser. Yes, the first Advancement Committee meeting, we really laid the foundation of the marketing department, how it relates to moving the hospital forward. And in this meeting, we're going to be going through some dashboard snapshots and kind of digging a little bit deeper into some of the activity occurring within the Marketing and Patient Experience Division. I'm going to start with a brief dashboard, which has an overview of our FY26 Q1 and Q2 scorecard. From this, an access perspective, our emergency department and ambulatory volumes have remained stable year over year, indicating sustained demand across service lines. Digitally, both the Nashville General Hospital and Nashville Healthcare Center websites continue to function as key access points for patients seeking care, directions, and service information, particularly for our outpatient services. In terms of visibility and engagement, Instagram and LinkedIn showed the most consistent growth, supporting both community education and provider recruitment. LinkedIn engagement rates in particular remain very strong, reinforcing professional credibility. And from a reputation standpoint, Nashville General maintains strong Google reviews compared to peer institutions with a high response rate that reflects our active service recovery and accountability. And that's from all areas of within the Division of Marketing. So if we want to go through the first page of the report, just breaks down each of those sections with the access and patient volume. Our ambulatory visits range from 4,000 to 5,400 visits per month. Admissions and observations remain consistent even with a seasonal variation. Like most of the rest of the country, we should be seeing an uptick during the next report of those numbers. Our digital access and website performance ranges from 10,000 to nearly 20,000 sessions per month. And For the NHC website, it increased notably, reaching almost 7,000 sessions in December. One of the things we've done with social media and engagement is our video streams. We've been getting more into posting videos, and they had a 300% increase in viewership for the videos. So this pages 2, 3, and half of 4, where you see the scorecard, these are things that we track within the division on a monthly basis. Just, I'd like to get more into our patient volume, a deeper dive into Metro employees, state employees. We typically, in prior years, have broken it out by service line. It's still kind of a learning situation right now with the Cerner implementation from last year. And as far as getting those reports, marketing's on the little bottom of the list compared to some of the other areas within the hospital that have needs, obviously, greater than ours at this point. But we are working with Dr. Fair and her team and decision support to make sure that we get those numbers so that as toward the Q4 of this year, we should be able to have everything.
Kathy, do we have targets in these categories?
So we try to look at it based from prior year so that we can see, the goal is a 15% increase from prior year for us. But it's kind of a little apples and oranges right now based on the data that we had from 2024. And then we have hit the majority of our targets as far as what baseline you would typically see on social media, where it might be 1.5% engagement and we're over 3%. So we're very strong within that area. On the back of this third page under reputation management, you'll see our Google reviews for both the hospital and the Nashville Healthcare Center, and then we've added all area facilities just so you can see how comparable we are with the big three, I like to say, and we all know who they are. And then, of course, our community engagement remains strong. I broken it out between community engagement and business stakeholder engagement. We do a lot of events throughout the year. Some are more community focused, working with Metro Action Commission, or not Metro Action Commission. There's Chanel, you might have to help me. The NRCB, that they are more out in the community, where like Metro Water, Metro Action, I consider them a stakeholder engagement because they're our Metro employees and who we're trying to get to walk through the doors. We do a lot with Metro Public Schools, as well as having them know about the Metro Incentive Program. Even NDOT has recently asked Simone to come to their new hire orientation, which is huge, to be able to be all new employees that come in to share, hey, you have this opportunity to get your health care services without incurring copays or deductibles, and no, you do not have to change your doctor. We can handle all your ancillary stuff, extra things, your specialists, because we know that doctor relationship is so important. But if you go to need an MRI, coming to General is going to cost you a lot less, or a diagnostic imaging center, than it is going to any other facility, because it's covered under that incentive program. And that's for any Metro employee who carries Metro insurance, any Nashville Electric Service employee who carries their insurance, and state employees now. So that is something we'll be working with our state lobbyists to help with that at the state level.
Well, that's a huge opportunity.
It is. It's a very huge opportunity, considering the number of state employees just within this area, Metro Center alone, and we have a clinic right there.
Do you have any interview sessions or forum in which to help people who know about the opportunity but don't utilize the opportunity, and why they don't?
Where we've been successful is being able to connect with the individual Metro departments versus trying to push things out Metro-wide, so that we can go in there do a mini health fair, talk to the employees, and then they get to know the people working here. They trust what they've seen there. They see that, you know, hey, they really know their stuff. They're talking to me right now, doing blood pressure checks, A1Cs, and then seeing the downstream effect of an increase in Metro employees after those events. Also, on our scorecard, we have complaints and grievances noted. Those also go through our Quality Management Council Committee. What we have through patient experience is we always want to do service recovery at the time of any incident. That doesn't get tracked because we want to make sure it's taken care of immediately. Complaints are those things written or when we get a phone call, hey, somebody's upset, can you come down? Grievances are that last tier. It is usually patient safety risk, something involved where then you have to track it. You have to be able to make sure things are handled within a certain period of time because it all goes back to CMS. And then after that on there, we have started some ads with, and it says Thrive on there, just so you're aware. It's a third party that we use that actually maintains our website, our Nashville Healthcare Center website. So we've been doing a lot of online display ads specific to the Nashville Healthcare Center Bordeaux, really trying to drive the revenue. There's been some provider changes there, making sure they know who the primary care providers are in that space, what specialties are involved, and also tied in a little bit with the Diagnostic Imaging Center since it's in that same location. So the bulk of that is for the Bordeaux location. We also have a few dollars of the spend set aside for the Nashville Healthcare Pharmacy that's at the Metro Center location. And so we're working with Bowman and his team just so we can track, okay, this started in late October, how many new patients have gone through the pharmacy there, how many prescriptions, because the goal is to see an uptick with what they're seeing within their space.
How do we do that? I mean, how do we move that dial?
Well, we're trying to move it through the marketing, through the, so what it's almost, so there's the area that the Nashville Healthcare Center, Healthcare Pharmacy is in. So within that catchment zone, anybody who logs on to Facebook or social media is going to get a pop-up ad. So we geofence the area that's within range specific to that location. And then from their side of it, they should be tracking the number of prescriptions they do a month, how many are unique patients, how many of those unique patients are actually new patients. Now, on the hospital side and the clinic side, I consider a new patient somebody who hasn't been in the system in 3 years. So if you haven't been here within 3 years, that's what we consider a new patient. Yep. Next, we go through the marketing and brand management, where our marketing priorities are. For the upcoming year, I've included right behind it our content calendar. A lot of this information are things that we, like the blogs, what we're planning on doing with WKRN. Those are things that we know what, like cancer awareness days are throughout the year. So, you know, we're going to be writing and putting blogs up and promoting those providers. February is Heart Month. We have a women's health, female cardiologist. We want to push her out there. We also have Dr. Akama, who's back, who is an interventional cardiology. So we'll be spending a whole day with that team next week, I believe, to get a lot of content, a lot of filming, so that we have plenty of things to push out and increase their numbers starting in February for Heart Month. So with that, we have media briefs that we'll be planning on doing, as well as there's a couple of speaking engagements that Dr. Elders has on the books, 2 involved with our Congregational Health and Education Network at First Capital Baptist Church, and then 15th Avenue Baptist, and then a Rotary meeting with Dr. Hildreth February 2nd. We do have some government relations events. We have meetings set up January 14th with the listed state representatives or senators. And then the Tennessee Hospital Association actually has a day on the Hill in February that we'll again go back, but we wanted to make sure there was an intro meeting before just showing up in February and saying, hey, here we are. And I'm working with Dr. Blackledge, and we'll be having some infographics to be able to one-pagers to hand out so that quick and easy things to digest about Nashville General and the Nashville Healthcare Center.
Kathy, this is just so random as you usually get from me. Do we ever do things like have maybe a team of folks go over to the legislature to offer flu shots?
We have not done that.
I mean,
We
things
did a
like
couple
that
of
to create an awareness of the
pop-ups.
things that we do.
Right. I think that's part of the conversation we were wanting to have with Megan, so to see what opportunities are out there that we haven't taken advantage of.
Great.
To do. And then, of course, we have a couple of community events, and then the Nashville General Hospital events at the bottom. Those are pretty standard events that we do every year, so you're aware of where those fall on the calendar. So just this last December was a hot and heavy month for my team. We had service awards for employees, which HR did do the bulk of it. They did a great job. But then we had 2 days at the historic Jefferson Street Holiday Village. And then we had an alumni brunch where we bring in former employees to Nashville General just to try and make sure they're engaged with all the things that we're doing. And then we had our 11th annual Secret Santa event. I do want to thank the members of the board and everybody who donated toward that cause. We did a record-breaking 200 children. We typically do about 75, and I pushed it to 670. I was trying to get away with saying 150. And then we had some events that led us to making sure an additional 25 children were taken care of that week. So it was a great event. We do know that we have to make some changes for next year just to make sure that it maintains the integrity of how we want it to be as it was the previous 10 years. So.
Especially if our target for next year is 400 children.
Oh, no, I think they'll walk. As much as we would love to do it, knowing the amount of, our staff really takes pride in this. They truly do. And it is amazing how, hearing stories of somebody coming up and going, I need to get my child. My wife loves doing this. And then the gifts are just magnificent. And we did get a wonderful note Reverend Fuzz and I had received via text that I sent out to the hospital on the daily huddle of a grandmother who had submitted her 2 children and just being so appreciative of what they had to open on Christmas Day. So, and that's why we do it. But we also want to make sure we're taking care of our patients and wanting to kind of expand that list to ensure we're hitting the right people. Yes.
Madam Chair.
Have we considered expanding this? And again, this is, I understand, quite laborious and I even know with good intent. But have we considered expanding it to other metro divisions that would be either marketed to help support financially what's going on here, or in partnership in conjunction with, just the patient population. So I guess what I'm saying is Metro Water, maybe they do something for their constituency and population, but if let's say, I don't know, another entrant, NES, something, is if it could be marketed and then say, here's the impact that's happening in another metro entity, would you guys be willing to donate? And that, might be able to be driven through the camaraderie of various leadership within the metro entities to help. And I know this because this happens in United Way, right? We have these United Way campaigns that are pushed down at corporate levels that email blasts go out. So I was just curious if we could kind of superimpose that mindset and get the volume up, but understanding that there's only so many people that can do this. Maybe we can get some volunteers, or lean into the foundation or something.
Well, the foundation is a partner, and this year we did bring on Bridge Builders, who was an incredible partner. They actually donated the toys. So typically each child gets an outfit, shoes, a coat, a hat, a book, and a toy. And this year they just had to worry about the apparel. But yes, there is a Metro group called the Metro Executive Secretaries Association that we used to work very closely with when they would do their own little fundraising things and make sure that we would get clothing in for our sexual assault victims, because many times their clothes have to stay and go in the break sent to the, for all that, and they would donate items for that. They would donate items for the babies. And then Metro Action Commission actually has a couple of classrooms. And so we could explore that a little better. It's a great idea. Thank you.
Please go ahead.
Next is Nexstar, which is actually Channel 2. This is a new partnership. We had been partners years and years ago, 2008 to be exact. And had actually done some commercials and things with the mantra of "We are Nashville." So, well before the flood, but then it became the mantra of the city for the flood. But it's exciting to be back with WKRN. One of the things that we worked with them on was the Toys for Tots. So in addition to everything else we had going on, we wanted to drive people to go to our off-site locations, so we made those drop-off locations for the community to come in and bring toys for Tots. And then on the morning they did their event, Dr. Elders and the team were able to be out there and to be interviewed on TV. But I apologize. Oh, never mind. I have the password here. And the other thing that we've done is we have a couple of commercials that are actually out on Channel 2 right now. And I'd like to play that. If I could get the volume going. Caesar left. There's no volume. Anybody? So it is about standing the test of time. It is about Nashville General Hospital being here for generations, and then you have employees who have actually worked here for generations highlighted on this. So there's two different sets of the commercial, and yes, unfortunately, I did make one. I was hoping I picked the other one and not this one. That's okay. Oh.
Kathy, while you're working on this,
I can actually email it to y'all, and then that way
Well,
you can watch it.
I really like the idea that people are in the spots because it personalizes a building. And people
Yes.
see the building, but they don't know what goes on inside. And what goes on inside is people doing great things. And showing those people is a really terrific idea.
Do we
Thank
have,
you.
do we have a similar message that showcases all of the services that are available to Metro and state employees?
As far as a commercial, no.
Or a YouTube video?
Those are part of the things that we're working on with, we have that whole day that is going to be very specific to cardiology, but the goal is to do every service line and do an overview because it's Nashville Healthcare Center, but then this is pushing Nashville General Hospital. So yes, we are getting there.
Just a quick question about the video. And Ellen, him asking because it seems that the younger generation, not my generation, but the younger generation, really likes the videos.
Yes.
But the videos are not a 5-minute video or a 3-minute.
Right.
They like the short
The
clips,
short clips.
these mini movies that are popular or whatever they're called. The TikTok-y things.
My team gets tired of hearing me talk about
Right.
TikTok, but
But
yes.
it seems like these little quick clips are these people who are influencers are picking these things up and running with them, and that's how to market today. And so I was just curious about, has the marketing department considered, I think, yes, young people, maybe it's not people like me who are sitting on, Insta or whatever every day, but, then your kids are talking about it, or I want to go get my flu shot here. So I'm just wondering, is there a way to consider how we were marketing to these young, because y'all are younger people, but even younger than you two ladies, and how we use the current ways with of both the TikToks and the, I guess, whatever, but the platforms there are, but these quick clips and using influence who might have a passion for the similar things that we have a passion for here and following our mission. So just, I know there's a lot of people out
I
here.
love your comment because that's exactly the path we're going to. You saw the big jump in videos and what we started doing in social media. It's not an opportunity, is to get the providers when we come to them, because we really want to highlight some of the providers because that's who people want to see, and getting them to be comfortable enough in front of the camera to do some of these things to make sure that we have the little clips to be able to put out there, and then click more, and then it goes on to a longer video that might explain what their service line is. So yes, we're going down that path. And we actually have started a monthly meeting with the ambulatory team. We're going through everything on the website to make sure all the service lines have the correct information, the things that we do, make sure the providers are all right there with the most up-to-date photos. Some have been pulled from years ago, and it's like I've got pictures on things that it's like, yeah, I know, don't look like that anymore. So we need to really go through and update some things. So the other piece to WKRN isn't just the commercials, but I wanted to share with you what I thought was pretty interesting in some of the research that they provided to us as far as like the target area that we were looking at in Bordeaux, and understanding how many areas of Nashville have changed over the years. And this is definitely one of them, and how Nashville General Hospital actually looks compared from their perspective when they're looking at how we are. We got a score of an 83, which they said was very good on our current outlook from our website, our social media presence, our Google reviews, and our SEO, and then just sharing what the average hospital ad spends are. And that's one of those items that I think we've always been pretty cautious with. I'm glad to say, we made some changes within marketing over the last year, and I appreciate the board for stepping in and helping with that. So the price of this campaign doesn't come near to what we were spending on other things. So it's really able to shift costs to things where we can actually be able to track and trend and see the differences that they'll make. And then just comparing to the competition, that when you look at this page, yes, Vanderbilt's going to be number one from name recognition, but then right behind it was Nashville General.
So Kathy, our numbers in many of these categories are pretty good. Mm-hmm. But it doesn't seem to be driving the patient volume at all. Seems pretty consistent.
We have to ensure, so there's two sides of this coin. The one is getting the word out there. The other is when they do come, making sure that we're scheduling the appointments appropriately, great customer service when they walk in the door, not billing when we shouldn't be billing if they're a Metro, State, or NES employee. So the backside of the house, we have to make sure that we're top tier when it, because that's the only way we'll win. I don't have the money for these ads that my counterparts have in the community, and that's where I was saying we need to be like the Savannah Bananas of healthcare here at Nashville General, just doing things outside of the box to get people in here and make them know that we're here for them and to make sure that they're healthy, not we're just here for you to come in the door.
Major paid media right now is not a huge option for us.
Correct.
So unpaid publicity
Earned.
is what we have to do, everything we can to explore and utilize every opportunity, of which there are many in Nashville. So we have a great strategy, but we have to execute.
Correct.
And it would be great if you had a ton more resources to work with. But that day will come, because success breeds success.
We are small but mighty, the team I have
Okay.
around the room.
Love it.
Thank you. Let's see. So one of the things we're also excited about is within this schedule with Channel 2, it allows us to not just have the commercials, but actually be on their local on 2 segments once a month. So we're working with them for Heart Month, making sure we have a cardiologist there, talk about things. And so that way our people are visible on TV as well. And that gives us additional videos and segments that we can push out.
And can you let us know when those dates are
Yes.
as they come up,
We can.
so that we can watch them live, if possible?
Most definitely. Lots of different streaming, audio, and then desktop and mobile. And then they have just ads that will be on smart TVs, gaming devices. So you never know where you're going to get a message from Nashville General Hospital. Next, government relations, we kind of already touched on that our objective is to make sure that our priorities are clear, consistent, and we have credible engagement with state and local officials. I know Dr. Elders has been meeting pretty consistently with Metro officials. We have a very engaged board chair who meets very consistently with Metro officials. So, and I think that's been one of the things that we know is very important, is having those relationships in the right places and maintaining them and knowing that you're just a phone call away. So even with that, with the Metro Council, I was contemplating passing out something to the board members here, just so we know who you might be connected with at Metro Council. And then that way, and I'm happy to send it out by email, we know, oh, wait, something's going on in this district. Let me call this board member who has a relationship. Because many times things, unfortunately, do pop up, fortunately, unfortunately. And it is best to not just have somebody on the hospital side, but knowing who the appropriate board member is who has the relationship to have that phone call as well.
Which I think is terrific to further engage board members where it's appropriate. I think we will have even more discussion about developing a robust strategy at our next full board meeting, so that we can have a better understanding of the issues that we are pursuing, but not only what the issues are, but how we are pursuing them. And that everybody understands that, so that if there is a need at a given moment during a legislative session or a council session, that people can be called upon to assist our lobbyists and you and Dr. Elders where appropriate.
Wonderful. Thank you. The next section is on patient experience. So Stephanie has really kind of taken this and run with implementing this heart campaign. You even see it on our video screens. It's on all of our backdrops, and she's been going to various departments and talking about customer service, because that's the differentiator for us, how we treat people. And it has to go from the top down, from the board all the way down to the person, opening the door for you when you walk in or assisting with transportation. And so each of the leaders have been given packets every month. There's a different theme each month, so that we're out there and connecting with the employees as well, to show that to them. It's not just down, it's up and down communication with everybody.
And I know, Kathy, we've talked about this before, but to further emphasize, that first walk in the door is so critical to the impression that one has about the hospital, whether coming in as a patient or to visit a patient or just supporting a patient, that experience is a very, very important experience. And how we can improve that by getting feedback from the people who work there, but also from casual observations. And I would ask our committee members to spend some time at the front, if you can, whether before a committee meeting, before a board meeting, afterwards, or just popping in when you can, to spend some time there and observe for yourself how that experience is and what can be done. It's important to see the real element of that on a constant and usual basis. So thank you for that, Kathy.
Yes, and thank you, because that's a great segue into our foundation partnership request. So at the last foundation, I wasn't at the last foundation meeting, so I apologize. I did have a meeting with the new foundation board chair and Dr. Brown, and we were reviewing items that we felt the foundation could make the biggest impact on from that patient experience standpoint, and wayfinding is one of them. We moved into this location in 1998. We've made a lot of changes to this hospital as far as where clinics are located or different departments are even located. So you see a lot of the signage on the wall versus the signage that hangs from the ceiling versus some of the new signage my team's trying to put up. And it's about a $300,000 investment. Ms. Jansen was great, and she gave me a name that I'll be following up with just to get I have had one quote for wayfinding, but we'll bring somebody else in to get a couple more. And then that would be a huge ask for the foundation to be able to help us with that. And even understanding that we don't know where the hospital is going to be in the next 5 years. So do you want to make that large of an investment? But what are some of the things that we can do to make that happen? The other request was for an ultrasound machine. That was about a $45,000 request.
And Kathy, we're going to get an update in a moment when you're finished from our new interim director of the foundation.
And just some of that information is put in the packet as well, just so you could see what items were part of the initial scope and impact request, whether it was patient care, infrastructure, security, and the healing environment and navigation. And we're so thankful to the mayor and the city for providing dollars to help with some of these capital requests, especially around mattresses and beds and televisions, things that you think are standard at other organizations should be standard here as well, because we're people taking care of people. And then last but not least, just our priorities and forward look, maintaining the scorecard and digital performance, taking into consideration all the suggestions today. We'll move that. We do have a meeting this Friday for the team to flesh a lot of things out. We're meeting with Meharry closer to the end of the month, bless you, so that their Meharry Medical Group service lines and our service lines are aligned. We started with the duck initiative in November for the baby. So every baby born at Nashville General gets a little duck, and then November of next year we're going to have a big party, and the pond's going to be full of ducks, and we can't wait. Any questions?
Questions from committee members? Kathy, thank you very much for that report. I would ask our board members, our committee members, to take a real look at the packet of information that Kathy has given each of us And if you have questions or comments, observations, suggestions, talk to Kathy directly. I know she appreciates the input from all of the board members. There's a lot of stuff here. And sometimes just racing through it can be a bit confusing, but I would urge everybody to take a closer look at all of this. I know it will raise some questions and hopefully raise some recommendations as well. So thank you, Kathy. Much appreciated.
Thank you.
Now I would like to ask our interim director, newly interim director, as of this week, Olympia Williams, to give us an update from the foundation. Good afternoon, Olympia, and congratulations.
Thank you so much. Okay, so the update for the foundation as of December the 16th, Nashville Wine Auction awarded us $88,000 for oncology breast spa, in which we will be working with the oncology department to see how we need to allocate those funds for the patient's needs, as well as recently on Tuesday for the Yarborough Foundation Fund, we were awarded $20,000 for the food pharmacy. So that's to kind of help fight against food insecurities within our community.
Olympia, can you remind us what the annual budget is for the food pharmacy?
So the annual, as of right now, we're averaging about $3,000 a month that we're spending for Second Harvest Food Bank that we're responsible for paying. So right now we're on track to have all those monies for the rest of the year.
$20,000 is a nice, big, fat piece of that budget.
Yes.
And we should express from our committee as well as the board great appreciation to the donor for a wonderful donation to a great cause.
Right. And we're also, we have a few board members that's working on some events. Hopefully in March, we'll have either a gala or we're going to have something like some kind of auction. We're still working on the logistics for that to kind of raise money for capital campaign as well as other monies for the food pharmacy as well. So, anybody else have any questions for me?
Okay, if not, Olympia, thank you so much, and once again, congratulations.
Thank you so much.
We'll be looking forward to hearing more from you as time goes by.
Yes, thank you.
Any questions from our committee members? Any comments from our committee members or Dr. Miller?
I saw here in environment and navigation, this $3 million projection. Is that something that has been proposed, or what is that about?
So environment and navigation is all the key items in there. So the emergency department redesign, inpatient room upgrades, waiting room renovations. The wayfinding is included in that, the van, and a truck replacement. So all of those items have an estimated cost of $3 million.
And has that been a proposal?
These items, so the capital items have been priced out, but not all of them have been approved. Do you want, Dr. Brown can step up here as well.
Dr. Miller, to answer your question, most of those have been approved. The ED refresh has been approved. That was part of the capital, the $2.5 million that we got from Metro, and the $2.1 million that we received from Metro. The vehicle, Ray and I just approved that not too long ago, so that should be coming to the board. Everything that you see on that list will come to the board once Jerry has started, or before he starts each of the projects. I can send you a list of things that we've completed thus far to the board members if you guys would like that, to see where we're at and how much of that money that we've spent thus far, especially for like infrastructure things. So the refresh on the floors, they're working to get the furniture packaged together. We're working with an interior person for paint and things like that. So I can get that information to you guys if you would like.
Dr. Miller, you okay? Okay. Dr. Martin, any questions or comments? Mr. Harvey? If not, I'll ask our board chair if you have any closing comments before we adjourn.
None, but thank you. I guess most importantly for all of you. Sorry. None, but just most importantly, thank you for Kathy, your team, and all of you in the room that are doing the work and making this come to fruition. These are not conversations we were having a year or two ago. To be able to talk about these things that help our hospital and our patients is really tremendous to be able to focus on that. So thank you for the work, and looking forward to the continued partnership with the foundation. So
Thank you, Madam Chair. Appreciate that.
thank
And
you for your leadership and starting this committee and coming up with that idea too.
Well, thank you. I think what's important for staff to know is that board members are interested and want to support, want to help. We don't want to get into the day-to-day activities, that's your job, but where we can be of assistance, where we can contribute some ideas that can be helpful, we want to do that, and we encourage each other on the board to do that, but also you telling us what you need is really, really helpful so that we're in sync. Everybody's working together for the same goal. I love what you said a moment ago, Kathy, when you said we're people serving people. And that's what it's all about. That's great. One last thank you, and that's to Ms. Lester for the work you do quietly every day. Thank you. If there's no other activity to be discussed, no other comments or questions, do I hear a motion for adjournment? Second? All in favor? All opposed? The ayes have it. We are adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.